It's estimated that somewhere around 8 to 10% of adults globally have ADHD.
Hmm.
But here's something that always gets me. For a huge number of those diagnosed as kids, we're talking like 50 to 70%, those tendencies, they stick around right into adulthood.
Yeah, that persistence is really significant.
Okay, so let's really dig into this because when ADHD comes up, I think our minds often jump straight to, focus issues or maybe
Basic
hyperactivity.
classic symptoms.
Exactly. But the reality is, the way ADHD shows up can ripple outwards, touching pretty much everything from how we handle emotions to just, well, our everyday behavior.
That's such a key point. And getting a clearer handle on those connections, especially understanding how ADHD symptoms might tie into feelings like anger
Sure.
or even, the potential for aggressive reactions,
Hmm.
that can be incredibly valuable.
For sure.
Whether you're looking inwards at your own experience or maybe trying to better support someone you care about, this is information that can really make a difference.
And that's precisely where we're headed today. We have got a really interesting study that recently came out of Russia looking specifically at ADHD symptoms and aggression in teenagers.
Oh, interesting.
Yeah, so we're going to pull out the most insightful sort of nuggets from that. Plus, we're also tapping into resources from organizations like CHED and getting insights from men's ADHD support networks to paint a broader picture, especially when we talk about adult men.
Right. So our goal in this deep dive is really to distill the essential findings about that relationship, the one between ADHD symptoms and aggression.
Hmm.
We want to see if there are any notable differences maybe in how this plays out between genders, and ultimately understand what this all kind of boils down to, especially for adult men navigating life with ADHD.
Okay, so let's jump right into that study from Russia. They looked at a pretty big group, over 2,800 adolescents. Average age was almost 15. Now, this wasn't about formal clinical diagnoses, just to be clear. They used self-reporting. So the teenagers themselves filled out questionnaires about their ADHD symptoms. Things like, hyperactivity and inattention.
Got it. And what's fascinating here, I think, is that the researchers didn't just lump aggression together as one big thing.
Right.
They actually broke it down
Mm.
in different types. So you have cognitive aggression that's more about how someone thinks about anger, like constantly replaying angry thoughts, anger rumination.
Okay, yeah,
Then there's behavioral aggression, the actual actions, physical, verbal, that sort of thing.
makes sense.
And finally, affective aggression.
Mm.
That relates more to the underlying emotions, like something called trait anger. Think of it as someone's general tendency towards anger, maybe a shorter fuse.
Like a baseline level of irritability almost.
Sort of, yeah. A predisposition. And importantly, the researchers also gathered info on whether these kids were dealing with other emotional or conduct problems at the same time. Comorbidity.
Okay, so they had all this data. What were the big connections? What did they find when they crunched the numbers?
Well, the main finding was really pretty significant. The study showed that clinically significant levels of those self-reported ADHD symptoms were linked to all those different types of aggression.
All of them. Wow.
Yeah. Cognitive, behavioral, and affective. So things like that anger rumination we mentioned, holding aggressive beliefs, engaging in physical, verbal, social, even planned, goal-oriented aggression, proactive aggression, and also that underlying trait anger.
That sounds like a really, really comprehensive link then. A whole web of connections.
It does.
And here's where it gets really interesting for me. Did these links kind of fall away if the adolescents were also struggling with other stuff, like anxiety or conduct issues?
That's a great question. And no, that's a crucial point to understand here.
Okay.
The researchers specifically factored in those co-occurring emotional problems like anxiety or depression, and also conduct problems, rule-breaking defiance.
Right.
And even after accounting for those, the association between the ADHD symptoms and all those forms of aggression, it remains strong.
So the headline is, ADHD symptoms and aggression are definitely linked in teenagers.
Yes. But the maybe even bigger takeaway, this connection isn't just because these kids might also have anxiety or conduct disorder.
Right, it's not just a side effect of something else.
Exactly. They specifically checked for that, and the link held up regardless. That points toward a pretty direct relationship, doesn't it?
It really does. That's important because, it can be tricky sometimes untangling what's influencing what when multiple things are going on.
For sure.
Now, did the study also look at sort of general patterns in aggression between the boys and girls overall? Like, forget ADHD symptoms for a second, just baseline differences.
They did, yeah. And generally, they saw some patterns that tend to show up in lots of studies. Females overall reported higher levels of that trait, anger, that tendency to get angry, and also more anger rumination, that replaying of angry thoughts.
Okay. And the boys?
The males, on average, reported holding more aggressive beliefs, so more likely to think aggression is sometimes okay. They also reported more proactive aggression, that planned type, and higher levels of physical and verbal aggression.
Okay, some fairly, let's say, typical or commonly observed gender differences there in aggression generally.
Right.
But what happened when they specifically zoomed in on the adolescents who did report significant ADHD symptoms? Did those same patterns just carry over?
For the most part, yes, those general trends were still there. However, they did find one specific difference related to sex when they looked just at the adolescents with ADHD symptoms.
Oh, what was that?
Males who had higher levels of ADHD symptoms reported higher levels of social aggression compared to females with similar levels of ADHD symptoms.
Social aggression. So that's like spreading rumors, excluding people, that kind of thing.
Exactly, trying to damage someone's reputation or relationships. So specifically in the ADHD group, boys reported more of that than girls did.
Huh. That's a really interesting nuance. Now, you mentioned they also considered the role of those co-occurring conduct problems. How did that fit into the picture with aggression?
Right, this is where it gets a little bit more intricate, actually.
Yeah.
They found that conduct problems did seem to influence the link between ADHD and aggression, but maybe not quite how you'd first guess.
How so?
Well, for the adolescents who did not report significant ADHD symptoms.
Okay, the non-ADHD group.
Right. For them, having conduct problems did increase the likelihood of them experiencing more trait anger and more social aggression.
Okay, that makes sense, right? You'd kind of expect behavioral issues and anger, social friction to go together.
Absolutely. But here's the surprising part. For those adolescents who were already reporting clinically significant levels of ADHD symptoms,
Yeah.
the presence of conduct problems didn't really significantly increase their already elevated levels of trait, anger, and social aggression.
Wait, really?
Yeah. It's almost as if the impact of the ADHD symptoms on those specific forms of aggression, trait, anger, and social aggression was already so strong.
That adding conduct problems on top didn't move the needle much further for those specific things.
Exactly. It didn't make a huge additional difference in those specific areas for the group with ADHD symptoms.
Wow, okay. So, stepping back, what are the key takeaways from this adolescent study then? What did the researchers themselves conclude from all this?
Well, the study's main conclusion really hammers home that when professionals are assessing and treating ADHD in adolescents, they absolutely should be paying close attention to aggression.
Mm-hmm.
The fact that they found these links across so many different types of aggression, even after accounting for other potential factors, suggests it's a really important piece of the picture for many young people with ADHD symptoms.
And they even suggested, didn't they, that the level of aggression someone shows could potentially be an indicator of how significant their ADHD symptoms are.
Yes, that was one implication they discussed. And they also highlighted the finding about proactive aggression, that more planned, goal-oriented type.
Right, you said that was interesting because some other research maybe didn't find that link as clearly.
Exactly. Some previous work suggested proactive aggression might be more separate from core ADHD symptoms, but this study found a link there too.
And I remember reading they also touched on that idea of anger rumination, getting stuck on angry thoughts. How did that fit in?
Yeah, they suggested that this tendency to dwell on angry experiences might be another way ADHD symptoms contribute to ongoing aggressive behavior.
Oh, okay.
It makes sense, right? If you're constantly replaying frustrating or angering situations in your mind, it keeps those feelings very active and could potentially lead to more aggressive reactions later on.
Okay, so we have this really detailed snapshot from adolescence. Now let's shift gears a bit. How might some of these findings connect or relate to adult men living with ADHD? Especially thinking about the info we have from groups like CHADD and those men's support networks.
Yeah, it's a really important connection to try and make.
So from the study, clear link, ADHD and various aggressions, even proactive. Some gender nuances, like higher social ambition in boys with ADHD symptoms.
Yeah.
How might these patterns or maybe the underlying mechanisms show up in adult men?
Well, we know that in adult men, ADHD often manifests as things like impulsivity and definite challenges with regulating emotions.
Right.
And if you think back to what we just discussed from the adolescent study, those are precisely the kinds of underlying difficulties that could potentially feed into the aggression they observed in the teenagers. That impulsivity, that difficulty managing frustration.
And we saw in the CHED information that men with ADHD might have a tendency towards more risky behaviors generally, didn't we?
That's right. Their resources highlight that adults with ADHD can be at a higher risk for things like, well, impulsive spending, risky driving, substance use, and, very relevant here, potentially aggressive behavior.
Mm.
The underlying factors, they often point to things like difficulty thinking before acting, challenges with decision-making. They certainly seem to resonate with the findings from the adolescent study, don't they?
They really do. It's also interesting how society sometimes views ADHD symptoms differently in men versus women. I recall reading that certain, maybe more externalizing behaviors in men might get brushed off or even seen as, I don't know, assertive.
Yeah, boys will be boys sometimes, unfortunately.
Right. Whereas the same behaviors in women might be labeled very differently, perhaps more negatively.
That's a really crucial societal lens. And unfortunately, these differing perceptions can absolutely contribute to underdiagnosis of ADHD in men, or at least a significant delay in getting diagnosed.
So if certain behaviors, which could actually be linked to underlying ADHD and maybe these potential issues with aggression we're talking about, are just seen as fitting a certain male stereotype.
Then the chance for earlier identification and support gets missed.
Exactly. And if we circle back to that concept of trait anger, that was generally higher in the adolescents with ADHD symptoms in the study, it makes sense that adult men with ADHD might also find themselves struggling more with their emotional responses, maybe having a lower threshold for feeling frustrated or angry.
Absolutely. And as one of our sources mentioned, this underdiagnosis in men can also unfortunately lead to feelings of shame or denial.
Oh, yeah.
If a man is struggling with anger management or impulsive reactions, but doesn't realize it could be connected to undiagnosed ADHD, he might be way less likely to seek help. He might see it as a personal failing, rather than a neurodevelopmental condition that can be managed.
The info from CHAG also briefly touched on workplace challenges for adults with ADHD, right? Like difficulty staying focused, acting impulsively.
Yes.
It's not hard to imagine how those kinds of daily frustrations could also build up stress and potentially trigger some of those negative emotional reactions.
Exactly. And another really common symptom often highlighted for adults with ADHD is that difficulty with the self-regulation of emotions, just managing the intensity and duration of feelings.
Mm-hmm.
And that can create significant friction in relationships, both at work and personally. If you're consistently struggling to manage your emotional responses, it's naturally going to affect how you interact with people.
So when you put it all together, it really feels like understanding these potential links between the ADHD symptoms and emotional responses like anger, the kind highlighted in that adolescent study, is a really important piece of the puzzle for adult men, too.
I think so.
It could be a crucial first step towards just recognizing the need for and then seeking out the right kind of support and strategies.
Precisely. And it's so important to keep remembering, as our sources consistently emphasize, that ADHD is a recognized neurodevelopmental condition. It's not some kind of character flaw or a sign of weakness. And, on a hopeful note, many adults with ADHD actually do develop really effective coping mechanisms over time, sometimes without even consciously realizing they're doing it.
That's true.
Recognizing the underlying ADHD can then empower them to build on those existing strengths and maybe more effectively address any remaining challenges they're facing.
Okay, so let's quickly recap some of those key insights as we start to wrap this up.
Yeah.
We saw from that Russian study with adolescents a really significant connection between ADHD symptoms and various forms of aggression, cognitive, behavioral, affective.
Right. And crucially, that link held up even when other issues were factored in.
Exactly. We also noted some interesting nuances in how aggression presented differently in boys versus girls, both with and without ADHD symptoms, particularly that social aggression piece.
And then when we connected these findings to adult men with ADHD, we talked about how the impulsivity and the difficulties with emotional regulation, often seen in adults, could absolutely be related to those aggression findings in the younger group.
Yeah, and we touched on how societal perceptions and the potential for underdiagnosis in men can mean these issues sometimes go unnoticed or untreated for longer.
And the real importance of framing ADHD correctly as a neurodevelopmental condition, not a personal failing.
Ultimately, this information matters because it can lead to just a deeper understanding, whether that's for your own personal insight, maybe for better supporting someone you care about who has ADHD, or even for professionals to refine how they assess and support people.
Yeah.
Recognizing these potential links feels like the foundational step towards finding more effective ways to help and develop useful coping strategies.
Which I think raises a really important question for you, the listener, to maybe mull over. Considering these specific ways that ADHD can intersect with our emotional responses and behaviors, How might a more nuanced understanding of these connections lead us to develop even more tailored, more effective support strategies? Not just for teenagers, but right through into adulthood for people living with ADHD.
That's a great question.
It really pushes us to think beyond just the headline symptoms of inattention and hyperactivity, and to consider that broader emotional and behavioral landscape for individuals with ADHD. We definitely encourage you to maybe explore some of the resources we touched on today, and of course, consider reaching out to professionals for that personalized guidance and support.